How accurate is MRI in detecting migraine triggers? Have you ever wondered how effective magnetic resonance imaging is in identifying what triggers migraines? It is a common question among those who suffer from these debilitating headaches. Let's break it down. Magnetic resonance imaging is not primarily designed to find migraine triggers. Instead, it plays a key role in ruling out other potential causes of headaches. This includes checking for structural brain issues, tumors, or vascular malformations that could lead to similar symptoms. In this way, magnetic resonance imaging helps confirm that the headaches are due to primary migraines rather than secondary causes. When it comes to identifying specific migraine triggers, such as certain smells, lights, or foods, magnetic resonance imaging does not provide that information. However, there is a specialized type of magnetic resonance imaging called functional magnetic resonance imaging. This technique measures brain activity by detecting changes in blood flow. Researchers use it to study how the brain reacts to sensory stimuli known to trigger migraines. Studies using functional magnetic resonance imaging have shown that individuals with migraines often exhibit unusual brain responses and altered connections in areas responsible for processing sensory information. These findings suggest a link between brain activity and sensitivity to migraine triggers. However, it is important to note that functional magnetic resonance imaging is mainly a research tool and is not yet used in clinical settings to identify individual triggers. In terms of accuracy, magnetic resonance imaging can help distinguish migraines from other headache disorders. It may reveal white matter changes or other brain alterations that are more common in people with migraines. However, these findings are not specific enough to pinpoint exact triggers. Research indicates that the accuracy of using magnetic resonance imaging to classify migraines compared to healthy individuals is moderate, with some studies suggesting around 70% accuracy. For patients experiencing frequent or severe headaches, magnetic resonance imaging is beneficial for ruling out other neurological issues. It can also monitor changes in the brain over time, especially in chronic migraine cases. However, identifying migraine triggers usually depends on a patient's clinical history, self-reporting, and sometimes controlled exposure tests, rather than magnetic resonance imaging results. In summary, while magnetic resonance imaging is a valuable tool for evaluating headaches and excluding other causes, it is not accurate for detecting specific migraine triggers. Functional magnetic resonance imaging research offers some understanding of brain mechanisms related to migraine sensitivity, but it is not yet applicable for clinical trigger detection.